emergency department after claiming to have overdosed on clonazepam. Patient has taken an unknown number of clonazepam from a bottle she had. However, she was found to have different stories to different personnel, and her urine drug screen was negative. Placed in the hospital for observation with plan for psychiatric evaluation and treatment. Do you recall that?
Yes, I do, and it was to the conclusion of my medical doctor that due to the traumatic effects of court proceedings ongoing with Mr. Clary, that I had actually had a conversion episode.
What's a conversion episode?
It's just where it's completely normal due to post-traumatic stress, and
going to court triggered post-traumatic stress syndrome?
yes, due to the multiple abuse during the marriage of Mr. Clary, which included several rapes.
Did you take the clonazepam or did you
No.
not? Did you just thought you had?
I had thought I had.
Okay. And then, just a little while later, looking at tab 17 at this point, benzodiazepam overdose. This is 3/2 of 2012. Patient seems to be fabricating the story regarding her divorce and remarriage and complaints to the judicial system. Did they think that at that time? Was that a separate incident? Did you go in again?
No, I did.
Well, is benzodiazepam the same as clonazepam? You don't know? Okay. All right. All right. Now, also in the medical records, there is significant evidence of some mental problems, is there not?
Yes.
You have a diagnosis of major depression, is that right?
Actually, at this time, I have a diagnosis of, what is this here? And this is from my therapist at Life Skills of, it's when it's, I don't know the name exactly right now. It's on the tip of my tongue, but it's where your surroundings are frequently changing.
Well, and yours are, aren't they?
Yes.
Because you've been divorced and remarried and divorced and remarried
Well,
sort of a couple of times.
court and.
In April of 2010, your past medical history, you indicated Charcot-Marie tooth, major depression, generalized anxiety disorder, questionable bipolar disorder, hypoglycemia, and DJD. Is that right?
DJ what?
DJD is what it says. Do you know what that is, Eva?
No, I don't.
Okay. Is that a degenerative joint disorder?
Yeah. Okay.
Does that sound right?
Yes, I do have problems with my joints due to the Charcot-Marie tooth.
Okay. Now you also indicated on November the 7th of 2009, and this is tab 11. Sorry, tab 10, my apologies. That you fell down the basement steps, is that right?
Yes.
This is in November 2000, I'm sorry, I've got the date and the tab wrong, my apologies. April 14th, 2010. You fell down the basement steps, is that right?
2010. Yes.
Okay. Tell us about that incident. How did you fall down the steps?
I was packing a basket of laundry down to the basement, and my ankle gave way, and I rode and tumbled into the basket at the bottom of the stairs.
Okay. Was that due to this Charcot-Marie tooth syndrome?
not necessarily. I mean, it's just